So picture this. You just moved to Panama. You've been here only 1 week, and all of a sudden, you develop this crushing chest pain with shortness of breath, and you're afraid you're having a heart attack. What do? Let's talk about it. Hola familia, ¿qué tal? Now, this intro sounds a bit dramatic, but it is quite possible that as a retiree, as a seasoned individual, you move to a new country and you experience an emergency. That's why we encourage you to watch these videos before you get here. So you know what's what. You know how the system is structured here and how healthcare is delivered here and in any country you choose to expat to. Before we get into the details, let me reintroduce myself. I am Maggie Lazar. I am a retired nurse practitioner, fully retired in the country of Panama, living my best life. And I'm also the creator of SWRA, Single Women Retiring Abroad, a group of seasoned ladies who have decided to retire to Panama. Our goal is to grow old and die here. So we want to create community and establish a support system so we can age in place. If any of this sounds interesting or of interest to you, please consider subscribing to the channel and hit notifications so you'll be notified when I post a video or when I go live on Sunday morning, and for now on Wednesday evening as well. It is important for you as an expat to do your research. The research does not only go over housing and food, getting your visa, right? And setting your phone, utilities. All those are truly important, and I talk about them. But a very important part of it is healthcare, because if you're like me, access to quality healthcare was one of the things that attracted you to Panama. So I have a short time to explain to you really briefly how healthcare is delivered here. And then at the end, maybe halfway through, I'm going to be interviewing a physician here who is well known and beloved among the expat community, so you can get to know him a little bit better, feel his heart, and give you a sense of peace. Okay, so before I go any further, if you're having an emergency in Panama, 911, you can call 911, but we also have private ambulances that I'm going to put them in the chat that you can call. And one last way for you to get to a hospital will be to call an Uber. And that's why it is super important that when you choose your home, where you're going to live, you make sure you have access to a hospital. And that's why personally, I wouldn't want to live on a beach, because as you get older, those decisions should be made based on what might happen, what services you might need to have access to, okay? So in Panama, there is a public and a private system. The public system, the Panamanians who have worked and paid into like Social Security, they have access to the system. But if you also a foreigner or a resident like we are, we can also access the system. The physicians who practice in the public hospitals are required to also they might work in the private hospital, but they're also required to work in the public hospital. A lot of your physicians were trained in the United States, some were trained in Mexico, and a lot of them are bilingual. So the level of medical care that you're getting is pretty much equitable. So you don't have to worry about quality. What you might want to worry in the public system is access. You may have to wait longer because you have so many people waiting to get care. But the cost is going to be a fragment of what you would pay in the private system, okay? So understand you have access, it's just a matter of choice. And then it also depends on the complexity of the issue. So if I'm having if you were having that crushing chest pain, right? If you are close to a public hospital, maybe that's where the ambulance would be taking you. But maybe let's say you needed stents and you needed to have some kind of procedure, you might talk to your physician and they might take you to a private hospital. Then you're going to have to pay. All right. So I don't think this video is going to be long enough for me to go over all the different insurance companies that you might consider. But know that if you go into a public hospital, you don't need to have insurance. They're gonna take care of you, but before you leave, you're gonna have to pay. But like I said, it's a fraction. Someone I heard had like a hernia repair and it was like $350. People have IVs and x-rays and it's like $150. So if you're gonna become an expat, make sure you have some money, a credit card that you can use in case you need it, okay? The private system is just that, private. So that way you have nurses, not nurses, doctors and nurses who are specialized. They have great equipment. And one hospital, Pacifica Salute, is associated with Johns Hopkins. They follow the same standards of care. Hospital San Fernando is JCO accredited, if you know what that is, Joint Commission. So the level of care is great. Also but in those hospitals, if you were to go there, you're gonna have to pay out of pocket. The first thing they ask you is for your credit card, right? They charge you a certain amount when they think your care is gonna cost. And then once you finish and you're getting ready to go home, they'll tabulate your charges. And if there is a balance, they'll give you your balance, okay? All right. Now, most expats here in Panama, we pay out of pocket for healthcare. When we go see our physician, to get our teeth cleaned, to get eyeglasses, hearing aids, all these things you pay out of pocket, and especially it's affordable because it is still a fraction of what it would cost you. Plus, in Panama, your doctors are really accessible. You don't have to wait 6 months to get a mammogram. You know, it's Breast Cancer Awareness Month. You don't have to wait, 2 weeks to go get an MRI. If you can pay for it the next day, you go. Some of your physicians will even make house visits. The initial visit with a physician, a lot of people have reported the doctor talked to them for an hour and a half, went over a detailed history, look at all their medicines, sometimes take them off medicines. So the bedside manner is something we as Americans are not used to because it is very rare that we have a physician who spends time with us. And the physician I'm going to interview is going to reiterate that how important he believes that is in promoting health and wellness, right? So having said that, the difference between the public and the private hospital, it has to do with costs. A lot of people say, I have Medicare. Can I use Medicare in Panama? Medicare is only designed to be used inside the United States. If you go outside, Medicare coverage does not work. I learned a few months ago that you can use Medicare Advantage, which is the HMOs, PPOs, that the government has allowed those private companies to manage Medicare recipients' care, right? But if you know anything about HMO, the model is the same. You need authorization for everything. PPOs might be a little bit loose, but still, it's not like a true Medicare. So if you have straight Medicare, do not believe that you can come in here and yank your card and you're going to be covered. It does not work. You're going to have to yank out your credit card or some cash, okay? Now, the Medicare Advantage enrollment period is going to start in November. I think it's November through sometime in December. And you can choose if you have Medicare Part A and B, then you can enroll in a Medicare Advantage plan. We are told that by law, those plans are supposed to cover you for any emergencies when you're outside of the US. But again, you pay first, and then the institution is going to help you submit your claim to the insurance company, and then it's like, good luck, right? Because you know how they do. They throw some kind of wrenches in it, ask you for so many things, just to make you be discouraged so you don't get your money back, sadly. But that's what happened. And I think Jackie, who is very well known here, she said she had to use her Medicare Advantage. She paid, and it took her 8 to 9 months to get paid, to get reimbursed. And it wasn't even the full reimbursement. So I was thinking I was going to switch to the Medicare Advantage in November. I don't know. I'm still undecided. I've been here since November of last year. I've talked to an insurance agent. He's given me a couple of plans. One thing you need to understand, in Panama, you have those worldwide insurance companies like Aetna, Cigna, Blue Cross Blue Shield. They are here. If you're young, you can get coverage, right? And a lot of them will cover you up to age 60 or age 62 or age 64. You have to talk to the insurance agent about each plan is a bit different, right? Some of them have worldwide coverage, like Cigna. Or was it Aetna? I had Cigna or Aetna before I qualified for Medicare, and it was worldwide. And that's when I thought I was going to go to Rwanda, and they were going to cover me there. But it was close to $500 a month. So that's expensive. So when I qualified for Medicare, I dropped that. So right now, I only have Medicare, which won't cover me here. And if anything happens to me, I'm going to have to pay out of pocket. Another thing people encourage expats like us to do, especially if you have pre-existing condition, you've had cancer, you've had chemo, you have diabetes or some kind of chronic illness. Most insurance plans, the worldwide ones, would cover you, but at a high premium and a high deductible. The Panama health plans, some of them don't even consider you past age 60, 62, 64, depending on the plan. And some of them that would say, yeah, like there is one that will consider you, but they want to say, if you have any pre-existing condition, we want to wait 12 months or 24 months to even consider covering. So you got to understand all the ramifications, right? And if you've had cancer, you have really a chronic condition that you need really close follow-up with your doctor, this is a thing that might make you think about, do you really want to move abroad? Okay, so sometimes I talk about it's not for everybody. It doesn't necessarily have to do with personalities. It might be the circumstances, right? You may not be happy with the system that you have in the US, but if all your doctors are there and you were treated for some really crazy illness and you need to be following up with them, it makes sense for you to stay there, right? Or you're going to have to be making, visits back and forth for a while. All right. So we talked about pre-existing condition that a lot of insurance plans, especially the Panama plans, will not cover you. Oh, I just wanted to say there is one exception. There is a hospital, and if you've watched Jackie Lane, that's her last name, I think. She does a lot of videos about Hospital Santa Fe, and even the doctor I interviewed talked about Hospital Santa Fe. We have private hospital, public hospital. That is a public hospital, but they have crafted their own health plan that says, if you come to our facility, if anything happens to you, we will cover you. But I looked at that plan also, and it's like $150 a month, which is very affordable, right? But you can only use that facility, which means I'm thinking, well, what if I'm in a car accident? How do they know to bring me here? It's like, by the time you go into my purse to figure out where to take me, I might die en route. Another thing that you need to consider. So the hospital Santa Fe plan has been touted. This is like the last option because it doesn't consider age. It doesn't consider pre-existing condition. It might delay treating anything for like 24 months, but they don't come out and say, we're not going to cover you, okay? They don't have an age limit, which is if you're 75 and 80, that's probably the only option you have. But understand that you're limited to only that hospital, but they do have providers all over the place. And then the care, it's in an area that is a little iffy, and then it's like half and half. Some people say I had great care, and some people last week said I will not go back. People tell you the public hospitals are awful, and some people say I had great care. So it's hard, to know what to believe. And I've read some posts, people saying, the rooms weren't fancy, but they were clean. The staff, except the doctors, the nurses, do not speak Spanish, so make sure your Google Translate is right there with you, okay? And the CSS hospital, which are the public hospitals, I would imagine it's like any public hospital in the US where you have long waits and then it's like, okay? So it's a lot to think about. But do not come here not knowing the basics that you do have 911, but you may not make it to the hospital you need to go. And the traffic here can get so crazy that even if you had an ambulance, sometimes the traffic is so tight, there's no way they can get you there. So you have to get your mind to understand that if you have emergencies, chances are you might not have a good outcome, okay? So those are the kind of things that you think about if you choose to become an expat. You cannot expect the same level of care and process, that you got in the US. In fact, Dr. Duncan just now, I read a post, I watched a post that he did about the US healthcare system compared to other healthcare system, and they're like way down the line in terms of access. We have issues in the US. So when somebody comes and they say, oh, it's not up to par with the US, but compared to what, right? The rate of infections you get after you have a procedure in the US, the lack of, doctor caring for you, kumbaya, I care for my patient kind of thing. Those things pretty much don't exist over there. So make sure you think through those things and don't come here with your head in the cloud. This is the time, if you're older, you've lived your life, you have some things happen to you medically, you have to understand what the odds are, right? So what we encourage you to do is put some money on the side every month so that if you need to go see your doctor, you don't have to scratch your head. So when you're doing that budget, that should be a line in your budget to put $200, $300 on the side, to go see your doctor, do your mammogram, do whatever you need to do. I'm not a proponent of doing all these, screening, testing and stuff, but if that's what your doctor and the doctor was mentioning mammogram and all this and, vaccines and stuff, there are things that we need to do if we want to live to be 90 to 100, okay? So I know that this physician is waiting to the next segment. I'm going to interview him. And I apologize now that it's going to be a bit of a long video, but I think it's information that's important to you. You need to know, just like you coming to Panama and you're like, oh, I can ask Maggie a question. You have a doctor that if you come, something happens, and it's not just me, but all the other ladies in the area will say, call Dr. Duncan. So Dr. Duncan is going to be talking to me in the next few minutes, and I hope you sit and watch the interview and learn something. And then at the end, I'll close out, and then you can send Dr. Duncan a nice note. And a lot of time they'll say, go to a hospital or doctor and register. That way, once you go to see them, you're already in their system. That is something to consider. All right? So please don't forget to like the video, share, subscribe, and then hang tight. Dr. Duncan is next. All right, everybody, welcome back. Today, we are so happy to have one of Panama City's premier physicians who has graciously agreed to talk to us today. Dr. Duncan is beloved by the expat community here in Panama City. He has been caring for a lot of us, and it doesn't matter what Facebook page you go to. If you say, oh, I'm looking for a doctor here in Panama City, and most likely somebody is going to say, call Dr. Duncan. I wanted to ask Dr. Duncan to take this opportunity today because I'm doing this segment on health services for expats. What happens if you just land here, you're in emergency, what do you do? So we're gonna take these few minutes to get to know Dr. Duncan because we just wanna know his heart, why is he beloved? Why do people flock to his clinic? So Dr. Duncan, please take a few minutes to introduce yourself to our viewers, probably on a personal level to start with.
Okay. Again, thank you for the opportunity. My name is Ricardo Duncan, born and raised here in Panama City, Panama. One of four siblings, the only man, all three other were females. So that's us.
The king, the prince.
Nah, the guardian of all the other ones.
There you
Yeah.
go.
So yeah, a very close, tight nucleus family.
Okay.
And
And
yes,
also we
that's
want to know, are you an eligible bachelor? You're a married man, you have kids? Ladies want to know.
family man. Family man. I've been gracious and blessed. This year is going to be 10 years of marriage
Wow.
and one princess, 9 years old. So
One
that's,
princess. Oh, the prince is on the way.
yeah, yeah, that's it. That's it.
That's wonderful. Well, thank you so much. Well, it's nice to know that you're a family man because, values are a little bit different when you have kids. So, what about your professional life? I would like our viewers to know, your training and why you're doing the type of medicine that you're practicing now.
Okay. Yes, I went and studied in Mexico, Monterrey. They did med school. Actually lived almost 10 years there. I studied and then worked there for a while. It's all been traveling. I've been living in Panama, living and working in Mexico. My folks lives in the States. So while I was in the
Okay.
States, I did volunteer work, helping old people, take them to their appointments, things like that. So I've been around and see different medical systems and saw what I liked of all of them and what I disliked and wanted to change. Like my future for like the perfect blend of
Mhm.
medical attention, knowledge, taking care of the experience, the perfect medical experience. And I think that's what how Smart Clinic was born, of a desire of bringing high quality to the
Healthcare.
patient.
And I
Okay.
know you trained in Mexico. You did your internship residency, and then
Mhm.
because when you came back, because your heart, I think you mentioned, is with Panama, you wanted to come back and give back to your country. Then you had to have some additional training here, correct?
Yes, if you study abroad and you want to work here, especially in medicine, you have to do 2 years of internship. 1 year in a public institution in a hospital, and the other year in a rural community.
Mhm.
So I did that in Mexico. So when I came back here, I was reluctant, but it worked perfectly. So I additional training, got to know different part of the system. So that complemented the knowledge that I already had. And because I was in the state studying for the boards for quite some times, so getting that knowledge from the States, from Mexico and from Panama, it's like what what made what am I today? This concept is
So you mentioned the States. So did you have some training in the States as well?
when I was in the state, I was studying for the boards. I was taking a course
Okay.
to
But
make
you
the
never
board.
actually practiced in the US.
No,
Okay. So how long have you been in practice as a physician here in Panama?
say like more than a decade.
Mhm.
Yeah,
Well,
more
you're
than a
only
decade.
25, Doc. How can you have 10 years of
That
experience?
isn't healthy. I have to practice what I preach. I have to look the
Oh, you
part.
practice what you preach. You
Yeah,
should see him all slim.
try to,
You're
and
trying to. I
having
know it's not easy, right?
and having it. Well, I have the best trainer in my princess, so it keeps me active. Have to
That's
be,
good.
yeah,
That's good.
have to be.
All right. That's your wife, right?
No, that's my little one.
Oh, okay. Your
That-
little one.
yeah.
Okay,
So talking about the training, yes. Did training, like I said, in Panama City. And once I finished doing the training in a place called Bocas del Toro,
Bocas del Toro, okay.
Bocas del Toro, yes, I
Yes,
started then
yes,
working for a company that formed groups that went to the jungle and part of
the communities,
hard, like, access communities far from the city. There
right.
were doctors, engineers, nurses, teachers. So that was my first interaction with like community service, like giving
Mm-hmm.
back. That
Mm,
fun,
yes,
that was fun. So when I finished, I went back and worked at a clinic close home. But then I work in Panama Pacifico. That's place there, like 10
right.
years as a medical director,
So you
or I
were there
could,
10 years.
yeah, 10 years
Wow.
there. Oh, yeah, 9 years and a half as medical director. And over there, I could see the things what I wanted to accomplish as a doctor and the things I couldn't accomplish because it was out of my reach. Because it was
Right, right,
my part to decisions I could make. So the only
right.
way I could offer the service that I wanted to at the level that I wanted to, it was to break loose and did my own thing. So that's the point where we are
Yeah,
right now.
because sometimes your personal philosophy may not align with the corporate type of philosophy. And there are a lot of restrictions. So you
Yeah,
broke free,
scary thing. Oh,
literally. Yeah,
scary thing.
it
But
is scary.
I did. And yeah, there are times that when you realize that are the pharmaceutical companies and the insurance companies who's using their best interests instead of the patients, then you have to make a decision. And that's what I did with the clinic. And I think that's the difference. It's just aligning with the interests of the patients, just caring for them, really, really caring, taking the time. And
Yes,
so much of expats and my patients are like, you take the time to know the
yes.
patient.
We're not used to that now. You know that, right?
Yes, that's what they say. And I cannot understand that because if you don't take the time to know the individual as a whole, how are you going to take care of him? You can take care of the symptoms, and that is easy. This is what you have, this is what I'm going to give you. But if you want to take care of the roots
Root of the
and just,
problem.
you
Yes.
have to understand the
And
patient
it
as a
takes
whole.
time for you to impart that
Yes.
knowledge,
Yeah,
right?
that's not a one-time thing. It takes time.
And that's why you say it's a family thing, right? Because it's not like
Yes.
one visit, it's like we're family. So how long have you been on your own, Dr. Duncan?
Okay.
I
Last
know
year,
you were part
September.
of Expat Health Services before, like when I was here last year.
Actually, what I did, I met Charlotte. I want to refer to her as my fairy
Your
godmother.
godmother,
Yeah, yeah, because every month, like she does this amazing tour, like Black Expats
right?
in Panama. And for a week, you come to Panama. Like if you're thinking of relocating, then you go to
I think
different
a
places.
lot of people know about Charlotte's relocation tours.
So what
Yes.
she does in the first night, she brings professionals, and then the professionals, they are realtors, they are lawyers, the medical part,
And you're the
insurance
medical.
part, and I'm the medical part. So that's how I got exposed to a lot of expats.
And
So
you've
when I
gotten a
decided
lot
to,
of exposure. Yes.
yes, so when I decided to go on my own, one like, hey, are you in the Pan Pacifico? No, I'm doing my own thing. Like, where are you? And Bella Vista. So can I go? And just word of mouth has been amazing. So that's how. So going back to your question, 2023 September, we started getting the permit, everything. I would say on March of this year, we started with the
Only
physical.
in March. Wow.
Yeah,
I
yeah.
thought it
Before,
wasn't much longer than that.
No, the growth has been amazing. But yeah,
And I'd like,
just
now you close, right? You don't take any more patients. You full. Are you full?
always find time. We always find time. Yeah.
You know, sometimes you go try to get an appointment at a clinic in the US and it will say, no longer accepting new patients. And I'm like, what does that mean? I mean, you can't even see a physician. Okay, so now we talked about the restrictions that you had in the corporate medical model, and then your philosophy of wanting to spend time with your patient, get to the root of the problem. And I know you emphasize wellness. Now, when I look at your Facebook page and other, information about your clinic, which is called the Smart Clinic and Lab, right? It also says you do primary care, family care, and also occupational health.
Yes. What we do, first of all, we focus on knowledge. Giving the power to the patient. Like if you know the part that you play in your well-being, it's
Right,
easier. It makes
right.
sense. So many diseases, so many conditions can be prevented if you take care, if you take prevention, if you take care of wellness. Your
An
the
ounce of
focus,
prevention, yes.
yeah, that's our main focus on prevention. We educate, we get prevention, we talk about all the things that we can do naturally to take care of the patient. Don't get me wrong, if you need antibiotic, if you need medication for pain, we'll take care of that. Definitely take care of that.
Absolutely,
But if
absolutely.
we can liberate you from some of those pills that are unnecessary, we're gonna use all our efforts to do that in a natural manner. That's why we use like natural drips. We have our health plans. We try to focus on that. And our motto is welcome to the family, because it's very difficult to try to be healthy, be in a healthy society all by yourself. So having a
Right.
community of people with the same interest on your health, on your just being well,
Well-being,
that is,
yeah.
that is really huge.
So in your clinic, if somebody had like a minor injury, they can come see you,
Huge.
If somebody, has a bad cold, symptoms of COVID or
Yeah.
whatever, they can come see you. If they want somebody who wants to be their primary care practitioner to kind of look over and help them manage their diabetes, high blood pressure, obesity, you do that, right? And also my
Yes.
other question, I think I asked that in the Facebook sometime. What about if somebody needs to be hospitalized? Do you manage their care in that particular episode as well?
Well, hospitalization, I mentioned our health plans. The health plans are what we manage here at the clinic. We have specialists, we have general medicine, we have lab work, ultrasound, we have our therapies, all of that. But if you need hospitalization, there are different hospitals which we recommend. And once you are hospitalized, we do the follow-up. We do the
Okay,
follow-up. And
okay.
talking about that, we are reaching out with different hospitals to try to match and to upgrade our services so we can offer all the services from primary care to hospitalization. We can do a juncture like a
Okay.
joint venture.
So somebody can come to you, you provide the service, they can pay out of pocket, you
Mhm.
charge them, right? And then also you have a health plan that they can sign on where they get additional benefits of just health management, which you
Yes.
focus on wellness. And then you have other practitioners that you work with in different specializations, right? Who you can refer patients to. And I think you mentioned to me before that some of them come to your clinic to see the patients. So
Yes,
that makes
most of
it
them.
most of
Yes,
them,
most of them
okay,
come to the clinic and attend.
okay.
There's a couple that I have to refer, but the vast majority, they come to the clinic. The idea is to make it easy. One place where you take care of all your needs.
And of course, you being the general practitioner, if somebody had an issue, you are the specialist, you know who to refer that patient to. Let's say
Yeah,
somebody needed some kind of surgery, you know which hospital would specialize in that. Because, people want to know that. In my prior segment before this, I talked about the public system and the private system. And, it works great if you're younger, but once you hit 60, 70, then it becomes a
yes,
little bit more difficult. in Panama. So it's nice to know that you there and your staff to answer some of the questions that people might have. Because I know I don't have all the answers. And I myself, I need to follow my own advice, and maybe go to Dr. Duncan soon. I haven't been there yet. All right, don't. So this is wonderful, Dr. Duncan. Thank you. So what is your vision? I understand you mentioned you have another location. You're
Yes,
not busy enough?
oh, we try to. The idea is to get, um, as I mentioned before, I was in Panama Pacifico.
Right.
Like 5 minutes from there, there's a community, Tucson, and they wanted to join effort in making a wellness center. We have a location there where we are planning different things. I'll keep you posted. Different
Wow. And
activities
what's the
to
name
give
again? I can put
additional
it on the
benefits,
screen.
for
Wow. What
friendship.
is the name of the country club again?
Tucson Country Club.
Tucson. Okay.
Tucson, like the
All right.
bird.
So it is in Panama, next to Panama Pacifico area.
Yeah, next to Panama Pacifico area, like
Okay, so
5 minutes
Dr.
from there.
Duncan's gonna have another office there. So those of you who live in that area, Paitilla, Panama Pacifico, they might be able to go there. But your main office right now is in Bay Vista.
Yeah,
I did Uber there the other day. It's not that far, so people can, because I had a lady who was here last week and her first question was her ankle or something was swelling. And I'm like, call Dr. Duncan, and she did come to see you. And
yes,
she texted me
she did.
back to tell me what a glorious experience she had. And this is why I'm doing this program, just to let people know you're not alone, you have options. So what do you see yourself, Dr. Duncan, in about 5, 10 years? How do you see your practice growing?
Oh, definitely. I want to definitely change the concept of healthcare around the world. Is this concept of
Wow.
medicine is not reactive, just a preventive. That's the idea.
Proactive,
A
preventative.
branch
Wow.
of different clinics, but it's making more of a movement, having people excited about healthcare, doing different activities, and we're working towards that. Branching out of Panama. I'm very ambitious because I know the mission is worth it. So it's it's
And
a
you have
nice
all these cheerleaders behind you.
yeah,
That
that's
is
gonna help. That's
wonderful because
definitely
that's too late for me, unfortunately, as a nurse practitioner. I'm retired. But in the US, people know about prevention and they talk about prevention. But I always say in our system, there is no intention behind the wish, right? We can talk all day long, but then the people with the power, they just don't want to take the steps necessary. And that is such a shame. Such a shame.
especially in the States, which are in the States where if, if you don't have insurance, it's almost prohibited to go to a doctor. Insurance doesn't cover prevention.
Mhm,
Insurance doesn't cover prevention. So
mhm.
that tells you where their interests are
And then
aligned.
that's why people
So
who are
the idea,
and that's why people in poor areas have such poor health outcomes. In fact, there was this
yeah,
article in the last video you posted on YouTube. I'm going to link it, about the ranking of the US healthcare system compared to the others. I mean, I
oof,
knew that, but sometimes people talk so much about, oh, everything is shiny, and it's like, look at the numbers. It's not that good. But I think the idea of prevention and, when you talk about people who are poor, there was an article I read years ago. It says, tell me your zip code, in the US, zip code is like your location.
yeah,
Tell me
yeah,
your zip code and I'll tell you how healthy you are.
yeah, for sure,
Isn't
completely.
that sad?
That summarizes that tells the
And
entire
that was
story.
like, okay, that's it.
Yeah,
That's so
and
sad.
why
But
we need to break free of that.
yes,
Is you can see the people that has the means, of course, they're going to be as healthy as they
of
can be. They have
course.
all the information, but it's all about empowering the people with the correct information.
Yep.
You don't have to spend a lot. You just have to know what to do, the things to do, different
Mhm,
things, change your lifestyle, see
mhm,
yourself in a
mhm,
different frame,
mhm.
and it will change the way you live.
Yeah,
And that's
yeah,
the idea.
yeah.
That's my vision. It's
Yeah.
changed the body of the
So
patient.
that's your passion. So I think I cut that, and I don't want to hold you because I know you're a busy, busy, busy person. I wanted to thank you again. I just wanted people to kind of feel your passion for what you're doing, buy into what you're trying to do, because that's what I always say. I talk about prevention and wellness and health. And even as a practitioner, I wasn't one to just go for the pad and write for a script the first time because, like you say, and people are very happy that practitioners such as yourself and other physicians here will take the time to talk to the patient, learn your
Yeah.
history, look at all the medication. You know how it is. You have a side effect, use another pill. One side effect, use another pill. And then polypharmacy. So we appreciate the fact that you are a practitioner with a vision. And we want to really tell you that whatever we can do to support you in your vision, we'll do it. Not just people listening to me when they come to Panama to know that this is a new day. This is a different way to look at health and wellness. Then we want to be there to support you. So thank you again, Dr. Duncan. Any last words? 5 seconds or less.
But no, thank you very much for the opportunity. Thank you for helping me spread the word.
Of
And we'll
course.
be in contact. We'll be working closely together. Whatever I can do to help, count with me.
Well, I am here to support, I'm retired. If you need some help with whatever, I know I can't work. You don't have to pay me for whatever I can do. Whatever I can do to help you. And also Dr. Duncan has a YouTube channel, Dr. D, right?
Yeah, Dr. Duncan.
Dr.
DR,
Duncan on
yeah,
YouTube.
DR dot.
And I saw some shorts yesterday. He was showing the Hamlet maneuver and all kind of things. So he's a busy man. I don't know if I have time to do all that, but he's doing a lot of things. And you just need to get behind it. Just like my channel, people are buying into what I'm trying to say.
Thanks.
We want to go behind him and support him in whatever we can. Dr. Duncan, thank you so much. I know some patients waiting on you. I appreciate your time. God bless you and much success. Okay.
Thank you very much.
All
Have a great
right.
day.
Bye-bye.
Bye.
Bye, guys. Okay, so what did you think? Did you enjoy the video, the interview with Dr. Duncan? He's so cute and so nice. So I was very touched that he agreed to talk to us because, as an entrepreneur, I feel him. I know what it takes to venture out on your own, and he's a person of faith. So, and I think with a lot of faith, prayer, hard work, he's going to be successful. I think it's nice to know that we have a doctor who believes in wellness, all the things that I believe in, eating right, exercise, water, and he's in excellent shape. So he's a good model for us. So I hope you enjoyed the video. I'm going to put his contact at in the description. He has a YouTube channel, Dr. D. Make sure you subscribe to his channel because we are familiar. We can all grow together. And he did a video just today. I'm going to put a link to that video because that's information that you need to know. Because you know what? I'm an eternal learner. I'm always looking and learning. And so that was very good information. So that when we start thinking that we got it the best, it was like, it's not that good because I know that because I'm a healthcare person. All right, so next video, I'm probably going to interview one of our sisters. I'm so excited. I've been waiting to interview someone else after Sonia, and her video was so well received. We want to learn from each other. I still want to interview some badass women, retirees who are doing exceptional things. So if you know anyone you'd like me to interview, send me a note. And then we're going to get into the holidays, and I'm going to be traveling in November. So we'll see. So make sure you tune again, on a weekly basis. Join me on Sunday for our live. We have so much fun. I have to figure out what we're going to talk about this time because we always add a little chat. Last week, we went for 2 hours, and I'm hoping we don't do that this week because I'm only doing a couple of easy things. Usually it's because, I'm running my mouth and or I'm cooking too many things. But it's fun to, chat with people and get to know each other and just support and loving on each other. So thank you so much for watching. Thank you for helping me get to 4,000 subscribers. We're on our way to 5, and I give God the glory, and I thank you for your support and your encouragement. And I listen. When you ask me for something like your last video, I give you what you asked for within reasons, as you know. But anyway, I love you. God loves you. Let's keep it real. Au revoir. À la prochaine. Bye bye.